Hello everyone and welcome to Mindscope Media. Did you ever find yourself in a position of constantly reliving an event? Do you feel threatened by it? This is termed post-traumatic stress disorder, or PTSD. Hello and welcome back to my YouTube channel. In this video we'll be talking about what PTSD is and how it can be treated. So let's begin. PTSD is a type of anxiety disorder when an individual goes through a threatening or scary event. Even if you weren't directly involved, the shock of what happened could leave you having difficulty living everyday life. PTSD can cause insomnia, low self-esteem, and a lot of painful emotions. Your memory may fade entirely if you continually relive the event. The feeling of never regaining your life can be overwhelming when you suffer from PTSD. It can, however, be treated. Psychotherapy and medications can both be very effective in the short and long term. It is often more effective to combine the two kinds of treatments together. PTSD treatment will be tailored to your individual needs after a detailed assessment of your symptoms is conducted. Psychologists may be able to assist you with this process. Psychologists are available to help you. You can either refer yourself for assessment to a psychological therapy service or start this process yourself. In the case of mild signs of PTSD or symptoms lasting less than 4 weeks, the use of active monitoring may be recommended. Monitoring your symptoms actively involves keeping track of whether or not they improve or worsen. Some people who suffer from trauma get better within a few weeks without treatment because stats show that on average 2 in 3 people who develop problems do get better with time. A follow-up appointment should be scheduled with 1 month if active monitoring is recommended. Let's talk about PTSD therapy. There are 3 main goals of PTSD therapy: improve your symptoms, restore your self-esteem, teach you skills to deal with it. Cognitive behavioral therapy, CBT, is commonly used to treat PTSD. The idea is to change the thought patterns that are causing problems in your life. You may achieve this by talking about your trauma or concentrating on the source of your fears. Depending on your circumstance, you may find that group or family therapy is a better option than individual sessions. Let's discuss cognitive process therapy, or CPT. CPT sessions are 60 to 90 minutes long every week for 12 weeks. Your therapist will first talk to you about the traumatic event and how your thoughts about it have affected your life. He will then describe what happened in detail. You may find new ways of coping with your trauma through this process. The therapist will help you learn to consider all the things that were beyond your control so you can move forward, understanding and accepting that, deep down, it wasn't your fault, despite things you did or did not do. Let's discuss prolonged exposure therapy. PE will help you confront those things you've avoided due to the traumatic event. Usually each session lasts 90 minutes. Early in the treatment, you'll be taught how to do deep breathing to manage your anxiety when you're thinking about what happened. One by one, you'll confront the things that you have avoided. You will recount the traumatic experience to your therapist in another session and then listen to a home audio recording. It may help you ease your symptoms over time to perform this task as homework. Let's now discuss eye movement desensitization and reprocessing. Your therapist may not require you to disclose your experience with EMDR. You concentrate on it while you watch or listen to something they're doing. It may be moving their hand, flashing a light, or making a noise. When you remember your trauma, you want to remember something positive. A weekly schedule of 3 months is required. Now let's discuss stress inoculation training. SIT is a type of CBT. In a group or on your own, this can be done. The details of what happened won't matter. Changes in your approach to dealing with stress are much more critical. By relaxing your body and mind, you can learn how to prevent negative thoughts. In about 3 months, you should be able to release the addressed stress from your life. Now let's talk medications. The brains of people with PTSD process threats differently, in part because of the balance of chemicals known as neurotransmitters is out of whack. A fight or flight response easily triggers them, making you feel on edge and jumpy. Trying to shut that down all the time could leave you feeling cold and detached emotionally. You will lose sight of what happened and will not react to it, including nightmares and flashbacks during the day. They can also help you have a better outlook on life and feel more normal again. Fear and anxiety are associated with chemistry in your brain caused by a variety of drugs. Doctors will usually start with medications that affect the neurotransmitters serotonin or norepinephrine, including fluoxetine, Prozac, paroxetine, Paxil, sertraline, Zoloft, and venlafaxine, Evexor. I apologize if I didn't say that right, but I did try. Your doctor may ask you to use an off-label medicine if you need it. For insomnia and nightmares, a drug may help you with specific symptoms and related issues, such as prozazine or Minipress. There is no one or simple combination of medications that is likely to work best for you. It depends on what kind of difficulty you're experiencing, how the side effects are, and if you also suffer from anxiety, depression, bipolar disorder, or substance abuse. Some medications require time to be properly dosed. Some medications require regular tests, such as monitoring your liver or regular visits to your doctor due to their side effects. You may not get rid of your symptoms with medication, but you can manage them better by reducing their intensity. Suppose you are wondering about what you can do to help yourself. So let's look at that. There are a lot of things. Starting from your ability to survive the trauma is a good place, even if the skills you've learned were not useful today. There are numerous resources available that can assist trauma survivors in recovering from PTSD and regaining their mental and physical well-being. By writing, you can process trauma more effectively. A series of short sessions of writing may significantly reduce the severity of PTSD symptoms. It is possible to reduce your treatment time by combining writing with other therapies. A traumatic event does not have to be the focus of your writing. A life writing exercise may also help reduce symptoms of PTSD. Moreover, writing may reduce blood pressure, help children with PTSD cope with anxiety and depression, and reduce behavioral problems. People with PTSD can benefit from complementary therapies such as meditation and yoga. In addition to therapy and medication, yoga and meditation are recommended as alternatives. Yoga can improve your breathing, increase your body awareness, and help you respond to changing emotions. Through meditation, you can redirect your attention to gain a greater sense of control over intrusive memories. Online therapy is also an option. It may be less intimidating and more accessible than traditional therapies to attend therapy sessions through the internet from your home. Several different ways can be employed to get treated with it, including use of your smartphone, computer, or using an app. Trauma can affect the body physically, neurologically, and emotionally. PTSD may occur if the effects of trauma last longer than a month or if they disrupt your normal functioning. Treatment of PTSD symptoms involves psychotherapy, especially cognitive behavioral therapy, cognitive processing therapy, and prolonged exposure therapy. Both EMDR and EFT have shown promise when it comes to treating PTSD. Notice your symptoms and how you react to certain things. If you don't feel well, then you must consult a psychologist. Despite its short duration, trauma can have powerful effects that can last for a very long time. There are always ways to lessen these negative side effects over time and in the right situation. Well, that's all for this video. Check out our next video and don't forget to like, comment, and subscribe. Take care and goodbye.